So this is caudate, this is cephalad. It's opposite, right? Because we're scanning from downwards up. And basically, when I do this one, because it's kind of painful and then they have to walk on it, I'll do a tibial nerve block. And it works pretty well. Even 3 mLs of 0.25% bupivacaine on the tibial nerve can last a day. Not the 2 to 6 hours you usually see with other nerve blocks. For some reason, when you get to the popliteal fossa and beyond, these nerve blocks tend to last longer than the textbooks say. Okay, so here's another study supporting the use of PRP, saying it's better than steroid for the plantar fascia, which I'm not surprised about. Level 2 evidence. Another study, there's a randomized controlled trial, 90 patients. And another study, 60 heals. And at 12 months, patients were improved, and this was statistically significant. Wrapping up with the hip joint, you see the X-ray image here. You see the femoral head and the neck under ultrasound. You need to just put your needle somewhere into the capsule. You're not basically aiming for that, right? We're not aiming for that. This is a ball and socket joint. We're aiming for this. Okay, I'm just doing a steroid injection here, just showing you the technique. I use a 25 gauge, 3.5-inch spinal needle. I find it's less painful. It's actually a sharp needle, but I've, thank God, never seen any nerve issues by using this needle. It's not meant to be very echogenic. It's not one of those special anesthesia nerve block needles. It's just a very cheap, basic needle, which gets the job done. So in terms of the hip, they injected hyaluronic acid and PRP. They found in this study, this group of studies, the PRP was not superior to the hyaluronic acid. Here they're just demonstrating that ultrasound-guided PRP shots can be effective for the treatment of osteoarthritis. In this one, they did compare the PRP and hyaluronic acid, and they found that the patients with the PRP had lower pain scores. Greater trochanter pain. Here is the gluteus medius tendon inserting on the bone. Here's just the bone itself versus overlying. It's usually a tendinitis, not so much a bursitis. We call it bursitis, but really it's the tendons that are typically inflamed, and that can lead to the bursitis. The knee quickly, patella tendon, infrapatellar tendon. You have the patella on the left, the fat pad here, the tibia. You can inject suprapatellar. This is the cross section. This is your target. This is the sagittal view, okay, with your probe positioned as such. Okay. Last slide, I think. Lateral collateral ligament, lateral meniscus, which is a little hard to see here. Iliotibial band, which is on top. And lastly, they compared placebo, steroids, hyaluronic acid, and PRP for knee arthritis. Who do you think won? PRP. Thank you.